Your Excellency, Dr. Hussein Abdulrahman Al-Rand, Assistant Under Secretary of the Ministry of Health and Prevention, Health Centers and Clinics, Chair of the Conference Host Organization Committee, Dr. Donald Lee, President Wonka Ward, Dr. Anna Stadval, President-elect Wonka Ward, Dr. Wadi'a Mohammed Al-Sharif, President Emirates Family Medicine Society, Co-Chair of the Conference Organization Committee, Professor Chris Banwell, Professor Mohammed Farghali, Co-Chairs of the Conference International Scientific Committee, members of the Wonka Executive Committee and the Wonka World Council, President and Regional Representative of Wonka Regions and the Young Doctor Movements, members of the Conference Planning, Organizing, International and Regional Scientific Committees, distinguished faculty members and guest speakers. Ladies and gentlemen, my name is Dr. Asha Mhiri. It's given me a great honor to be your Master of Ceremony for the opening ceremony of the Wonka World Conference 2021.
Visionaries who built a story that would inspire for generations to come. They left a legacy of a timeless place to create a place beyond time. Where history and heritage meet innovation and ingenuity, where ideas take flight and light rains down from above. Their children celebrate this nation, its ancestry and artistry, with soaring notes and stunning songs that stir beauty from deep within, to show us that every day is an extraordinary poem waiting to be experienced. So when does yours begin? When you discover the culture of Abu Dhabi.
Welcome back, ladies and gentlemen. The mission of the UAE Ministry of Health and Prevention is to enhance the community health by providing comprehensive, innovative, and fair healthcare services as per international standards, and perform its role as regulator and supervisor of the healthcare sector through a modern and integrated health legislative system. Our next speaker, His Excellency Dr. Hussein Abdulrahman Al-Rand, will make his welcome address on behalf of the host organizing committee.
Bismillah ar-Rahman ar-Rahim. Your Excellencies, friends and colleagues, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Wonka 2021 virtual conference. I had personally hoped that we will all meet in person here in Abu Dhabi and to extend a very warm welcome to all of you. However, I am confident that my hope and warm invitation to all of you will be fulfilled in not too distant future. The World Organization of Family Physicians is an important partner and a catalyst in building primary and public health capacity. And I am sure we can work together on many fronts to benefit of UAE population and the broader EMR regions. Ladies and gentlemen, UAE has comprehensive government-funded health service and rapidly developing private health sector that deliver a high standard of healthcare to the population. Healthcare is regulated at both the federal and Emirati level. Public healthcare services are administered by different regulatory authorities in United Arab Emirates, including Ministry of Health and Prevention, Health Authority Abu Dhabi, the Dubai Health Authority, and the Emirati Health Authority. Due to success of this high standard of care across all stages of healthcare system, life expectancy in UAE is 76.8 years, reaching levels similar to those in Europe and North America. To date, healthcare in UAE has been funded mainly by the government. The UAE, in its modernized and path of reform, is now evolving this funding to focus on increasingly important public-private partnership. The UAE public policy for healthcare focused on developing organizational and legal framework based on best practice and to overhaul and upgrade the private and public sector health services capacities. Ladies and gentlemen, the coronavirus pandemic has tested public health system globally. Few novel and infectious diseases around the world have ever posed such dramatic challenges. The novel coronavirus SARS-CoV-2, which caused COVID-19, led to the World Health Organization to declare a public health emergency of international concern and caused countries around the world to reassess their public health capacity. The United Arab Emirates, like other members of the international community, faced the unprecedented challenge of ensuring public health and safety while minimizing economic fallout. The UAE government quickly took precautionary health measures after its first recorded case of COVID-19 on 29 January 2020, setting the stage for UAE to be recognized as a global leader in its COVID-19 response. The UAE banned large gatherings, limited international travel, required mandatory quarantine for travelers and those potentially exposed to the virus, encouraging telework, and began an unparalleled effort of mass testing. This effort by UAE leader allowed the UAE to be globally ranked as one of the top countries and highest in the Arab world in terms of its COVID-19 response. The UAE government also quickly charted the path to post-pandemic recovery by prioritized vaccination for the people. It began administered in its first vaccine authorized for emergency use, China Sinopharm vaccine, in December 2020, quickly followed by American biotech Pfizer vaccine. 4 main groups were targeted for inoculation, with the first group including Emirati and resident age 60 and older, people with chronic health condition and disabled. The second group was frontliner, healthcare worker. The third, other essential workers. And the fourth was member of the general public who want to be vaccinated. The shot became available at mass vaccination site organized by Dubai Health Authority, Ministry of Health and Prevention, Abu Dhabi Health Authority, and other health entities within the Emirates. As of June 1, 2021, more than 80% of UAE eligible population has been vaccinated. Ladies and gentlemen, although the effort of the Ministry of Health and Prevention, MOHAB, are focused on fighting COVID-19 pandemic as a national health priority, it did not overlook the development of the operational plan to ensure the continuity of its various health services without interruption. One of the key services provider is the Family Doctor One, due to its pivotal role in prevention and curative healthcare and as a central point of healthcare system. Ministry of Health and Prevention pointed out that family medicine is one of the international quality standards through which the culture and health level of the country is measured, and the assist thanks to its pivotal role in healthcare system around the world. The effort of the family doctor is supporting and assisting their fellows doctor on the front line of defense to fight COVID-19 and to provide the necessary health care, which contributed to increased recovery rate in commendable. Finally, I would like to thank all those that have worked hard to make VONCA 2021 virtual conference a reality. To thank all the members of the host, planning and the scientific committee, our guest speaker, faculty and moderator, as well as each of you who worked and participate. Wishing you all great successful virtual gathering, and once again, I look forward to welcome you all in UAE. Thank you.
Thank you very much, Dr. Arand, for your kind speech. Ladies and gentlemen, the Emirates Family Medicine Society brings together the best scientific experts to catalyze and advance scientific knowledge about the family medicine by presenting recent research findings via international scientific collaboration and realizing that family doctors' effectiveness depends on up-to-date continuing education. I would like to welcome our next speaker, Dr. Wadia Al-Sharif, to make her welcome address.
Your Excellencies, friends and colleagues, ladies and gentlemen, Assalamu alaikum. Good morning, good afternoon, good evening, and thank you all for joining the VONCA 2021 virtual conference. The last time I had the pleasure of meeting you all was in person in Rio de Janeiro, Brazil, where together with my UAE colleagues celebrated winning the bid to host VONCA 2020 in Abu Dhabi. As a critical milestone in building family medicine capacity within the EMR region. We had encouraged you all to take full advantage of the immense opportunities to be made available to you, both professionally and socially, at an upcoming VONCA 2020 physical conference, while emphasizing the significance of staging the big event for the first time ever in the EMR region. However, the spread of COVID-19 pandemic since early 2020 has taken all of us by an unpleasant surprise and has forced us to experience an unprecedented situation by encountering this invisible enemy that knows no boundaries, but disrupted every aspect of our day-to-day lives. Yet, it also made us realize the importance of building solidarity, connectivity, international collaborations, and has helped us all focus on our true identity as societies as well as individuals, making us reflect on a new world we could rebuild for our future generations in the aftermath. Nevertheless, here we are today in the most important gathering of the best minds in the family medicine world: leaders, decision makers, researchers, primary care and public health colleagues from all geographies gathering virtually to present, debate, and collaborate on shaping the future of the family medicine under the theme, Together We Own the Future. A sign of hope and determination for all of us to pursue. That said, I cannot emphasize enough how difficult it has been for all of us in the EMR region to miss the opportunity of hosting you in person in Abu Dhabi, to showcase our unique heritage and culture, as well as provide you with the first-hand knowledge of the significant growth, unique talents, and research available within this region. It's therefore greatly important for all of us here to continue to receive your support and preserve your promise to return to the UAE and the EMR region at the first possible chance. Dear colleagues, in spite of the tremendous challenges faced globally, we continue to witness and experience ongoing moments of transformation and an increased awareness of the significant contributions made by the public healthcare workers led by family doctors. The UAE is a shining example of how, with the right approach, the virus could be successfully contained, and how transmission can be controlled and suppressed with appropriate public health measures such as active case detection, isolation, testing, treatment, and contact tracing among our most powerful tools. By training healthcare workers on how to detect, prevent, respond to, and control the outbreak, and by coordinating a nationwide surveillance and contact tracing, epidemiology, modeling, diagnostic, clinical care, and treatment, we successfully managed to identify, control, and limit onward transmissions of the virus. Our National Preparedness and Response Plan has helped balance the demands of acting directly in response to the pandemic, while maintaining access to high-quality essential healthcare services, including routine vaccinations, care during pregnancy and childbirth, treatment for infectious and non-communicable diseases, mental health conditions, and much more. Friends and colleagues, I would like to thank my colleagues in the host, planning, and international scientific committees for their commitment and tireless efforts to bring us all together today. I especially would like to thank the WHO for their contribution and continued support to the EMR region and beyond, as well as a tremendous thank you to all of you, talented speakers, distinguished panelists, and moderators, for taking the time to participate from near and far. To all of you for joining us here today. The virtual conference agenda was allocated throughout the week with a short 4 to 5 hours per day program to ensure that the content is delivered in more convenient segments according to the different time zones. The program will include 3 days of pre-conference workshops, followed by 3 days of conference proceedings. Oral and poster presentations will be available for your viewing and interaction with the presenters throughout the conference days, and best of all, plenaries, special sessions, experts, and breakout sessions will be easily accessible on demand post-conference for all attendees to revisit at their own pace. There is a tremendous amount of scientific research planned to be presented this week by our young doctors who are holding a pre-conference sessions organized by regional future leaders to discuss universal health coverage, primary health care workforce, climate change, digital health, and many more topics. You will be able to participate virtually in vital conversations around primary health care, as well as network and partake in interactive and engaging experiences through a dynamic virtual conference platform, including interactive exhibition features. Ladies and gentlemen, I take this opportunity to commend all the teams working behind the scenes to have made WONCA 2021 virtual conference a reality today. We are pleased that this digital setting makes it possible to broaden the learning and engagement opportunities within our family medicine community globally at this important time. I look forward to interact with you all in various discussions and learning from your insights throughout this week. Thank you.
Thank you very much, Dr. Wadia, for your kind speech. Ladies and gentlemen, WONCA is an unusual yet convenient acronym comprising the first 5 initials of the World Organization of National Colleges, Academies, and Academic Associations of General Practitioners, Family Physicians. WONCA's aim to improve the quality of life of the people throughout the world by defining and promoting its values, including respect for universal human rights and including gender equity, and by fostering high standards of care in general practice, family medicine. It's with great pleasure that I invite Dr. Donald Lee to make his speech.
Hello, everyone. As we meet in these very strange circumstances, I want to welcome you wholeheartedly to our WONCA Conference 2021. In our lifetimes, we have never experienced anything like what we've gone through in the last 2 years. I know for some of us, travel and meetings have resumed at least to an extent. And for others, it is just too dangerous still to relax our guard and expose ourselves and our populations to increased risk of the mutating virus. We are hopeful for a future where vaccines will enable us to resume lives which look close to our previous normal. For now, we will make the best of the opportunities we've got and pay tribute to the scientists who are and have been developing vaccines to make us all safer. As I welcome you to our conference, I also want to pay tribute to each and every one of our members who rose remarkably to the challenges we recently faced. You showed that in the face of extreme adversity, our Wonka family can and does work together, supporting each other and sharing our knowledge and experience right across the globe. The collaboration shown between individuals, between working parties and SIGs, between member organizations, across countries, regions, and even more extensively, shows the thirst for knowledge and for trusted research and evidence is strong. Obviously, there are some things that we'd like to return to, including comfortable ways of working and socializing. But we also realize that the pandemic created opportunities, or should I say challenges, to do some things differently. And we realize that some of those changes are good and deserve to be embedded in our systems. Others might need a little bit of finessing to make sure they work effectively for doctors, patients, and primary care teams. I want to thank and pay tribute to the host organizing committee and the PCO in Abu Dhabi for continuing to have faith that we would actually manage to have a conference at all. And a thank you to Dr. Mohammed Tarwan and the team from Eastern Mediterranean region for their successful bid to host the conference. I know how disappointed you are or in not being able to host a conference face-to-face. There were times when the logistics and arrangements seemed just too daunting, but with patience and a lot of imagination, we are managing to bring you a conference with some live events and some pre-recorded sessions. It's different this time. Usually at Wonka Conference, most of us are suffering from jet lag as we travel far and wide to attend the conference. This year, some people will be participating in live sessions at times of the night and morning when they would normally be sound asleep. So I thank all those who are making the effort to work through the night or to get up in the early hours of the morning to contribute and participate. Our conference theme is Together We Own the Future. I know you will hear some illuminating and inspiring talks over the coming days, and I hope they give you professional nourishment. Family doctors are under huge pressure right across the world, and if ever we needed confirmation that family medicine and primary care are crucial to our health systems, the last few years have given us ample evidence. Let us take from our conference theme the confidence and the courage to speak out, to promote, to show by example that what we offer our patients and populations gives them a future, a better, healthier future, so that together we will all own the future.
Thank you very much, Dr. Donald Lee, for your informative speech. Ladies and gentlemen, the International and Regional Scientific Committees of WONCA 2021 have been working incredibly hard, particularly in the current and presented international challenges, to realize and deliver a world-class world conference where the best minds can convene to further family medicine education around the world. Please welcome Dr. Mohammed Farghali, co-chair of the Conference Scientific Committee, to make his address.
Your Excellencies, friends and colleagues, ladies and gentlemen, Assalamu alaikum. Good morning, good afternoon, good evening, and welcome to the WONCA 2021 virtual conference. My name is Mohammed Farghali, a family physician, a loving and caring father, and a passionate advocate when it comes to the crucial role of family medicine as the foundation for well-being for all humanity. Let me begin by sounding the words of Dr. Arrand, Dr. Wadia, and Dr. Donald Lee. Indeed, we never expect this invisible enemy to disrupt every aspect. Carry with me fond memories of the overwhelming support we received from the council member at the time of presenting our bid to host the WONCA World Conference. And I will continue to seek your support to return to United Arab Emirates and to the Emirates region at the very first possible opportunities. Ladies and gentlemen, I know Dr. Wadia covered a good deal on the conference program in her speech, so I will keep my presentation fashionable, one that is long enough to make our case, but short enough to be interesting. As co-chair of the International Scientific Committee, I am delegated to acknowledge and extend the deep appreciation of both Professor Chris Van Wel and myself for the hard work and dedicated of my colleagues, the member of the international and regional committees, which has greatly contributed to bringing to the light the WONCA 2021 virtual conference. Thank you all. It is always a pleasure working with you. The high level of interest shown by regional and international organizations to collaborate at the WONCA 2021 is clearly represented by the record 93 countries in attendance. This pinpoints the importance of our first global gathering since 3 years. We have over 400 oral and poster presentations, 6 special sessions, 104 workshops, 4 plenary sessions, and 4 industry symposia included in the program, which will address the ongoing demand to access the latest research findings on the global scales and to provide an engaging platform for collaboration for experts and young doctors alike. The educational program will cover a wide range of topics presented by some of the world's best minds in our fields, including planetary health, universal health coverage, communications, the role of family doctors in times of conflicts, and the natural disease, artificial intelligence, and digital health, human resources in primary care, global health, WONCA EMRO achievements and the challenges, as well as special young doctor movement sessions on family medicine practice around the world. Our deep appreciation goes to all our distinguished faculty members and speakers for taking part of their valuable time to be with us today. We would also extend our appreciation to the United Arab Emirates Ministry of Health and Prevention, the Emirates Family Medicine Society, the Emirates Medical Association, the World Health Organization, the WONCA Special Interest Groups, the WONCA Working Parties, the WONCA regions, and the Young Doctor Movement. You have all been part of and partial to bring this important meeting to life. Our appreciation also goes to WONCA 2021 sponsors and to all supporting organizations. Last but not least, our appreciation goes to our conference organizers, meeting minds, experts for their quality organization and attention to details. I look forward to your participation and meeting with you over the coming few days.
Thank you very much, Dr. Farghali, for your speech. Ladies and gentlemen, the UAE is open for business as we welcome millions of visitors to the Expo 2020, and we most certainly look forward to welcoming you all.
Come for the greatest global gathering in history with countries from all over the world. Discover the world's most inventive ideas. See devices that extract water from air, concrete that generates solar power, and the most sensitive radio telescope ever made. Marvel at the world's most inspiring architecture. Step into structures that produce electricity, spaces that change shape, and buildings that send messages to space. Experience the world's greatest entertainment with local and international stars, live concerts, and colorful parades. Take in inspirational art, sample exotic cuisines, and witness more than 190 countries and cultures come together in one place. Join the making of a new world.
Welcome back, ladies and gentlemen. I would like to thank you all for your participation. And now it's time to welcome back Dr. Donald Lee for his keynote lectures on PHC, UHC, COVID-19, and family medicine.
When every nation of the world signed up to the Astana Declaration, which was launched on 22nd October 2018, and when some of us had the privilege to be at the launch, we knew it offered a new commitment, making comprehensive primary care available and accessible to all. We welcome the very visible commitment of nations to establish where necessary and to further develop primary care services and delivery of those services right across the globe. Irrespective of WHO using newly coined phrases such as universal health coverage and integrated person-centered health services, what Astana promised was comprehensive primary care for every single person in the world. Some year prior to the Astana Declaration, at our Wonka conference in Prague in 2013, next slide, Margaret Chan, the then Director General of WHO and a personal friend of mine, said in her keynote address, next slide please, a health system where primary care is the backbone and family doctors are the bedrock delivers the best outcomes at the lowest cost and with the greatest user satisfaction. To hear her say that so openly and clearly was a huge encouragement for family medicine, and it encouraged us to strengthen our own efforts to influence and advise on family medicine at national, regional, and global level. So WHO is not, and was not in 2013, unaware of the relationship between primary care, family medicine, and universal health coverage. But it still took until December 2020 before WHO's special program on primary care was officially established in WHO Geneva. This was incredibly the first time a specific unit was tasked with issues around primary care. Next slide. The MOU we signed with WHO in January 2019 was a reflection of our growing collaboration. We have consistently responded to our member organizations, telling us how important they feel Wonka's relation is with WHO and how they want us to influence policy at the highest levels. We're very pleased to be working so closely with the WHO Primary Care Special Program, despite the challenges of being asked for inputs with sometimes impossible turnaround times. We will continue on your behalf and on behalf of family medicine generally to engage directly and robustly with WHO on issues of policy and practice in primary care. At the same time, we continue to engage with numerous other units and departments of WHO on issues which impact primary care and its delivery. Our working parties and SIGs are well placed to pursue and continue these links, and many of them are currently working closely with different branches of WHO on a wide range of issues. The road to universal health coverage was never going to be a straight one. If it had been easy to achieve, it would have been achieved a long time ago. There will inevitably be bumps in the road, but no one could have predicted the huge bump in the road that was and is COVID-19. Bumps in the roads are inevitable, but those inevitable bumps cannot knock us off course. Circumstances now require us, all of us, to recalibrate, to refocus on what universal health coverage should look like and ahead. Full steam in that direction until every single person has access to affordable, comprehensive primary care. Action and implementation are crucial. Even more crucial is political commitment, both local and global, to achieve the goal of universal health coverage. We need to tackle this challenge from a number of different fronts, speaking out at policy level locally, nationally, regionally, and globally, providing real-life examples of where working as primary care teams improves health equity and offers improved health status for populations. Next slide. The term universal health coverage, coined by WHO, translates into comprehensive primary care for most of the rest of professionals in the world working in the field of healthcare. At least the intention behind the new label was legitimate. It was hoped that the UHC label would serve to urge political leaders to every country to make delivery of comprehensive primary care a priority for their populations, to every single person, irrespective of their wealth or poverty. It also served as a message to global and multilateral development partners that their focus and their development resources should be targeted on achieving universal health coverage. As family doctors and as those leading implementation of family medicine, we can get caught up in the rhetoric of new global initiatives. I don't want us to do that. I don't want us to lose sight of the straightforward goal of achieving comprehensive primary care for every person in the world. I want us as family doctors to continue to put the case for improved and expanded integrated primary care services to be delivered by qualified and professional primary care teams. We need to get that message across loud and clear and at every possible opportunity. And we need to use the evidence available to support our position. We know the components of a good family medicine strategy and therefore of a good primary care strategy. The Primary Healthcare Performance Initiative, or PHCPI, was established after the launch of the Sustainable Development Goals with an explicit mandate to make primary healthcare the cornerstone of sustainable development, and that improving primary healthcare begins with better measurement. PHCPI works closely with government and development partners who are looking to strengthen primary healthcare, providing them with the data, information, and support they need to drive evidence-based improvement. Early in their work, PHCPI produced a template of what constitutes a good performing primary care service. Next slide, please. These are very good and legitimate starting points for a solid primary care system. As ever, when a system is described simply, there are nuances and details which are inevitably left out. And sometimes, as is the case here, the picture doesn't tell the whole story of what makes a good primary care system or a good health system with family medicine at its core. We in Wonka would argue that it's actually a bit more complicated than that, and we tend to use what we call the 10 C's. You've heard these and read these and know these, so I won't go into detail, but it's worth reminding ourselves about what the important features are of a good primary care system. Caring, clinically competent, continuity of care, comprehensive care, cost-effective care, coordination of care, common problem management expertise, community-based care and research, communication and counseling skills of high standard, and continuing professional development. We all live these every day of our professional lives. We may not always meet all the standards all the time, but we know what it is we aspire to, and we know what is globally possible to achieve if the appropriate political levers can be exerted. Way back in 2002, when the Wonka Guidelines for Improving Health Systems, the Contribution of Family Medicine, was published, the authors clearly stated what was needed to convince the leadership, as they put it, of the positive impact on health from a well-organized family medicine system. They said it politely and modestly, and perhaps we would use stronger language if we were producing this document today. But the words continue to resonate. Next slide. In the developing or strengthening family medicine as an impetus for improving health system performance, it is important to consider a variety of national contexts that greatly influence options for health policy development. Careful assessment of each nation's economic, political, and social conditions and epidemiological patterns of disease will allow leaders to select appropriate health policy strategies and to determine the resources necessary for family medicine to grow and contribute to health system improvements. We know that much of the work we do in family medicine is hard to measure. It does not fall neatly into usual quantitative data collection systems. Knowing a person's clinical history, their family history, their socioeconomic situation, and changes to that for whatever reason, these things are very hard to quantify. We acknowledge that, and we appreciate that work is underway to look at new and different ways of collecting and analyzing data, which is relevant to the way family medicine and delivery of primary care works. But PHCPI has been addressing this specific topic since the Sustainable Development Goals were launched in 2015, and unfortunately have not achieved what we expected. And we need to get on with showing how well, or otherwise, nations are achieving the promises they undertook to deliver universal health coverage. We were happy to hear from our colleagues in WHO Primary Care Special Program that in order to properly address the continued absence of an agreed data collection and information system to reflect primary care delivery, they assessed the number of classification and coding systems for primary care and family medicine. Next slide. In January 2020, at our regular WHO advisory group meeting, our WHO colleagues informed us that they have recommended ICPC, Wonka's own classification of primary care, to PHCPI as the most useful and relevant tool to capture the reality of delivering primary care. Next slide. We look forward to ICPC 3 being adopted by PHCPI and rolled out globally as WHO and its development partners return to addressing the big promises made by all nations to our population. There's no doubt that the pandemic has had a huge impact on all our lives, both professional and personal. It has also had a huge impact on how we deliver primary care. Challenges to continuity, comprehensiveness, coordination, accessibility are all being experienced in each of our practices. Despite the huge challenges, though, primary care continued to be delivered a bit in a different way by adapting and being flexible about how we clinically manage patients and their conditions. We know from our discussions at Wonka webinars and with colleagues in our friendship groups that some of the changes adopted were welcome, both to the family doctors and patients. Others may be less so. Adapting quickly to meet the ongoing needs of patients exposed some fault lines in our system. This was not entirely unexpected. As part of the recalibration I urged earlier, we need to reflect on the new way of operating and sift through them to ensure that we are developing best practices for future models of primary care delivery. Piecemeal development will not achieve the goal, especially when it is not supported by professional development of primary care team members. We need a quantum shift in emphasis towards creating that platform for delivering comprehensive primary care for everyone. We as family doctors must use our collective and individual voices to persuade, to convince, to influence, and to show the way. The evidence is now widely available that health systems based on strong primary care are the most clinically effective and cost-effective mechanism to improve the health of our populations, allowing them to be more productive. Not everything will survive a return to relative normality, but some of those adaptations will resonate and will improve the service we can offer to our patients. The increase in video consultations and telephone consultations will almost certainly continue. They will not, of course, replace in-person, face-to-face consultations. But for some doctors and some patients, online consultations will be welcome and will provide a more efficient way of addressing minor and ongoing health concerns. They also offer a way of starting a consultation from which a face-to-face consultation may follow, and if necessary, with a family doctor or an appropriate member of the primary care team. We also know that because of years of experience, COVID vaccine delivery has achieved fantastic uptake because in many countries, it is being delivered through family medicine practices. Our patients trust us, they know us. And as long-lasting vaccines are developed and being available, responsive to mutating variants of the virus, it is family doctors who advise the patients and deliver the vaccines through their practices and primary care teams. Achieving universal health coverage remains our goal. Family medicine's significant contributions to doing so is unchallengeable. Next slide. To conclude, there can be no universal health coverage without comprehensive primary health care. And there can be no comprehensive primary health care without family medicine. And that's exactly where Wonka comes in. We're here and we are delivering. Now the national politicians, national policymakers, and global funders need to catch up.